The clock on the wall read 11:47 p.m. The emergency room at St. Carver's Medical Center was bleeding chaos. Not metaphorically, literally. 3 gurneys crashed through the double doors in under 90 seconds. A highway pileup on Route 9. 8 people, for critical. And somewhere in the middle of the screaming and the alarms and the blue-gloved hands moving in every direction, a woman stood completely still. She wasn't wearing a doctor's coat. She wasn't barking orders. She was wearing scrubs that were 2 sizes too big, holding a clipboard she hadn't written a single thing on, and watching. Just watching. Her name badge said, Maya Chun, float nurse, first week. And in that moment, with everything falling apart around her, the attending physician, Dr. Harrison Wells, 12 years in emergency medicine, a man who had personally trained 19 residents, turned around, looked directly at her, and said the words that would change everything that night. Someone get this clueless new nurse out of my ER. She's been standing there for 10 minutes doing absolutely nothing. Security. 60 seconds. I want her gone. The room went quiet, quieter than it should have been, given the chaos. Nurses exchanged glances. A resident pressed his lips together. Even one of the paramedics rolling in a stretcher slowed down, just briefly, to look at her. Maya Chen didn't move. She didn't apologize. She didn't argue. She looked at the incoming patient on gurney 3, a teenage boy, maybe 16, whose oxygen monitor was beeping in a pattern that nobody else in that room had noticed, and she tilted her head, just slightly, the way a chess grandmaster tilts their head when they've already seen the next 7 moves. Dr. Wells, she said, her voice calm. Impossibly calm. Before I go, bed 3. His trachea is deviated to the left. Nobody moved. That's not from the crash, she added. Still nothing. She set down her clipboard. He has a tension pneumothorax. If you don't needle decompress in the next 4 minutes, you're going to lose him. Dr. Wells blinked. Then he looked at the boy, then at the monitor, then back at Maya. Who the hell, he said slowly, are you? But here's the thing. She didn't answer that question. Not yet. Because the answer to that question was the kind of answer that takes years to understand. The kind of answer that walks in through a door you weren't expecting, wearing scrubs 2 sizes too big, carrying a clipboard she never needed, and quietly saving your entire emergency room before anyone even realizes what's happening. This is the story of Maya Chun. And by the end of tonight, not a single person in that hospital will ever question her again. 3 days earlier, Maya Chun had walked into St. Carver's Medical Center carrying 1 bag and a paper coffee cup that had long gone cold. She looked, by every measure, ordinary. 34 years old. Medium height. Dark hair pulled back in a practical knot. No jewelry except a small, worn watch. Analog, military style, the kind you can read in the dark. She checked it twice before she even reached the front desk. Not because she was late. She was 10 minutes early. She checked it the way some people check a compass. Habitually. Instinctively. The charge nurse, Sandra Platt, 22 years at St. Carver's, handed her a stack of orientation paperwork and pointed toward a plastic chair in the corner. Float nurses wait over there, Sandra said, without looking up. Maya said, thank you, and went to sit down. She didn't take out her phone. She didn't read a magazine. She sat with her back against the wall, facing the door, a positioning choice so subtle that no one would ever think to comment on it, and she watched the ER move. For 40 minutes, she just watched. She watched a man in Bay 7 who was complaining of heartburn, but kept rubbing his left jaw. She watched a child in the waiting area who had a sprained wrist, but flinched at the wrong angle when the triage nurse touched it. She watched a woman who said she was fine, kept saying she was fine, but whose breathing was 8 beats too shallow. At no point did Maya write anything down. At no point did Maya say anything. She just cataloged, filed, stored, like a system running quietly in the background. When Sandra finally called her name and handed her an assignment sheet, Maya took it, glanced at it once, and asked one question. Is Dr. Reyes still on the chest pain case in Bay 7, or has he been reassigned? Sandra stopped. How do you know about that case? He's been in there 40 minutes and hasn't ordered an EKG yet. A long pause. He ordered it 20 minutes ago, Sandra said carefully. Then the results came back abnormal, Maya said. And he's waiting for cardiology consult because he's not sure. But the patient is presenting with a STEMI pattern. He shouldn't wait. Sandra stared at her. Maya stared back, pleasantly. I'll just go introduce myself to my floor assignment, Maya said, and walked away. Behind her, Sandra Platt, 22 years, unshakable, seen everything. Reached for the phone and pulled up Bay 7's chart. The EKG had come back 23 minutes ago. The results were abnormal. There were other things about Maya that people noticed, but couldn't quite name. She moved differently than other nurses. Not faster, sometimes slower, actually, but always with purpose. Every step had a destination. Every pause had a reason. When a code was called on the second floor during her orientation tour, every other new staff member jumped at the sound of the alarm. Maya's hand moved, almost imperceptibly, toward her left hip, as if reaching for something that wasn't there. She caught herself, and no one noticed. Almost no one. Dr. Priya Okafor, a second-year resident who had the unfortunate habit of noticing everything, was standing 4 feet away when it happened. She filed it away and said nothing. Later that night, alone in the resident lounge, she searched Maya Chin's name in the hospital system. Float nurse. Agency hire. Previous employment. Listed as various clinical settings. No hospital affiliations on record beyond the last 2 years. Before that, nothing. A blank. 7 years of Maya Chin's professional life, simply absent. Priya sat with that for a long moment. Then she closed her laptop. Then she opened it again. Then she searched something else entirely. But that story comes later. St. Carver's emergency department had a hierarchy as rigid and unspoken as any military chain of command. At the top, Dr. Harrison Wells, 12 years in emergency medicine, published in 3 journals. The kind of doctor who used his resume as a weapon in every room he walked into. His word was law. His tone was arctic. His patience for incompetence, real or perceived, lasted approximately 30 seconds. Below him, in descending order of importance according to Dr. Wells, the senior residents, the attending nurses, the junior residents, and then, somewhere at the bottom, below the man who restocked the supply closets, sat the float nurses. Temporary, replaceable, invisible. Maya walked into that hierarchy on a Tuesday. By Wednesday, she had already managed to make herself inconvenient. It started small. During morning rounds, she was standing at the edge of Bay 4 when Dr. Wells was updating the team on a post-surgical patient, a 58-year-old man named Gerald who had come in with abdominal pain. Mr. Gerald is stable. We're managing conservatively, Wells said, moving on. His pain pattern shifted overnight, Maya said. The team stopped moving. Wells turned slowly. I'm sorry. Between 3 a.m. and 6 a.m., his pain reports moved from diffuse to localized. Right lower quadrant. His temperature ticked up 0.4 degrees. It's in the chart. A beat. Could be evolving appendicitis. The silence was the specific kind of silence that forms when someone lower on the totem pole has just challenged someone higher, and might, inconveniently, be right. Wells looked at the chart. He looked at it for a long time. We'll order an ultrasound, he said finally, his voice stripped of all warmth, to rule it out. He said nothing to Maya. He didn't have to. The look he gave her communicated everything. You are a float nurse. You are temporary. Do not do this again. She did it again. Thursday brought a new crisis in the form of charge nurse Sandra Platt, who had decided, with the quiet authority of someone who has controlled a department for 2 decades, that Maya needed to be relocated. I'm moving you to the intake desk, Sandra announced that morning. Maya was currently in Bay 9, helping a nurse named Tomas with a post-cardiac patient. She looked up. Can I ask why? Because that's where I need you. Mr. Delgado in Bay 9 has a history of paroxysmal atrial fibrillation, Maya said. He's been in normal sinus rhythm all morning, but his last 2 pressure readings have been trending down. I'd like to monitor him for another hour. Sandra said nothing. Tomas kept his eyes on the monitor. Intake desk, Nurse Chun, Sandra repeated. Now. Maya looked once more at the monitor. She looked at Mr. Delgado's chart. She looked at Sandra. Of course, she said and left. 45 minutes later, Tomas called a rapid response for Mr. Delgado. His blood pressure had dropped to 80/50. By the time the team responded, Maya was already back in Bay 9. Not because she was called, not because she was assigned, but because she had positioned herself at the intake desk directly facing the Bay 9 doorway and had watched the monitor trend from 40 feet away. No one said anything about that. But people noticed. The person who reacted the worst to Maya wasn't Dr. Wells. It was Dr. Marcus Holt, a third-year resident who wore his authority like new shoes, stiff, uncomfortable, constantly aware of them. Holt was the kind of resident who had learned medicine from textbooks and had not yet discovered the vast, humbling distance between the textbook and the patient. He found Maya irritating in the specific way that people find anything irritating when it's better than them at something they consider theirs. "You're a float nurse," he said to her on Friday, loudly, in the hallway, in front of 3 other nurses and a medical student. "You're here for 2 weeks. You do vitals and 4 lines and whatever else you're assigned. You don't diagnose. You don't override orders. You don't second-guess attendings." He stepped closer. "Are we clear?" Maya looked at him. Not up at him, not down at him. Directly at him. "Crystal," she said. She turned back to her patient chart. Holt waited for something more. An apology, a flinch, a crack. He got none of it, which was somehow worse. He walked away with the specific discomfort of a man who has just thrown a punch and found the other person wasn't there. Behind the nurse's station, Priya Okafor watched all of it. She had her notebook open. She was writing something down. By Friday night, the stories about the float nurse were spreading through St. Carver's the way hospital gossip always does, quietly, rapidly, and with escalating embellishment. She called a STEMI before the EKG came back. True. Make 15 powerful images prompt of story scene by scene. She spotted an appendicitis on a patient Wells had already cleared. Asterisk true. The ultrasound confirmed early appendicitis. Gerald was in surgery by noon. She moved herself back to Bay 9 before the code was called. Also true, though the details were still fuzzy. The nurses talked. The residents talked. Even the overnight orderlies talked. What nobody talked about, what nobody had language for yet, was the specific quality of Maya's attention. It wasn't just that she was observant. It was the speed, the instant, total, threat assessment quality of how she looked at a room, or a patient, or a situation. The way she walked into a new space and, before she'd said a word, before she'd read a chart, her eyes moved in a pattern that was not random. Doorways first, then windows, then people, then equipment. Every time. Without fail. Tomas noticed it on Saturday morning when she walked into Bay 2 to help him with a dressing change. The patient was a large man, agitated, coming down off something. Before Tomas had finished explaining the case, Maya had quietly shifted her position so that she was between the patient and the door. Not obviously, not in a way that changed the care, but she was between the patient and the door. "You okay?" Tomas asked her. "Fine," she said. "Tell me about his last set of vitals." The incident with the pharmaceutical cart happened on Saturday afternoon. A new pharmacy tech, first week, 22 years old, visibly overwhelmed, was rushing a medication delivery to Bay 11 and clipped the corner of the nurse's station. 3 drawers popped open. A cascade of labeled medication packets fanned across the floor. The tech started scrambling, panicked, grabbing at things. Maya, who had been 12 feet away, walked over, crouched down, and began sorting. Not randomly. She sorted in under 90 seconds. Controlled substances separated first and placed directly back in a locked drawer, pediatric dosages grouped, anything requiring refrigeration identified and set aside. She looked at each label for approximately 1 second before routing it correctly. The tech stared at her. "How did you do that so fast?" Maya handed him the last sorted pile. "Mass casualty logistics," she said, simply, as if that were a normal sentence. Then she stood up and went back to her patient. The tech stood there holding the medication pile for a full 30 seconds before he could make himself move. Mini cliffhanger number 1. That same evening, Priya Okafor cornered Maya in the break room. "I searched your employment history," Priya said. No preamble. No apology. Maya poured coffee. Said nothing. 7 years missing. Before Mercy General, which you listed as your most recent hospital, there's nothing. No clinics, no travel nursing, no university hospitals. Nothing. People change careers, Maya said. To nursing? From nursing? Priya went very still. From nursing to what? Maya picked up her coffee. Looked at Priya with something that was almost warmth. Almost. You're a good resident, Dr. Okafor, she said. You notice things most people miss. That's going to save lives someday. She walked out. Priya stood in the break room alone, heart beating slightly faster than it should have been, aware that she had just received both a deflection and the most genuine compliment of her residency, and that somehow both felt important. Mini cliffhanger number 2. Sunday brought a different kind of tension. A man came into the ER claiming he was a hospital administrator from the parent company, doing an unannounced review. He was well-dressed, confident, moved through the ER with the practiced authority of someone accustomed to controlling rooms. Maya stopped what she was doing when he walked in. She didn't stop dramatically. She just paused, mid-sentence, with a patient. Looked up, looked at the man, looked at his badge, too quickly, from too far away for most people to have read it, and then looked at the exit, and then at the front desk, and then back at the man. She resumed talking to her patient. But Tomas, who was standing nearby, saw all of it. Later, he would learn that the man's badge number didn't match the parent company's format. He was a journalist trying to get inside access to a liability story. Security removed him an hour later. No one knew how the tip got to security. But Tomas had his suspicions. Mini cliffhanger number 3. Monday morning. The ER was running hot. Too many patients, too few beds, the specific grinding pressure of a system past capacity. Dr. Holt was managing a pediatric case, a 7-year-old girl named Lily who had been brought in by her father for a bad fall. Holt reviewed the x-rays, noted a forearm fracture, began the protocol for a standard pediatric injury. Maya was passing by. She slowed. She looked at Lily. She looked at the father. She looked at the way the child held her body, not the arm, the rest of her body, and something in her face changed. A different kind of attention came online. She checked the chart. She noted the last 3 months, 2 prior ER visits, different hospitals. She approached Sandra Platt at the nurse's station. The girl in Bay 6, Maya said quietly. I think we need a social work consult. Sandra looked at her. Before you say no, Maya said, look at the bilateral bruising on her upper arms. The grip pattern is consistent with, she stopped. Just get social work in there. By that afternoon, Lily was in protective custody. Her father was being interviewed by 2 detectives. And Dr. Holt was sitting alone in the resident lounge, staring at nothing, because he had looked at the x-ray and he had missed everything else. Maya sat down next to him. She didn't say anything. She just sat there. After a long time, Holt said, How did you see that? Maya was quiet for a moment. I've seen it before, she said. He wanted to ask where, when, who trained you to see things like that. But before he could, the trauma alert went off. 11:31 p.m. Monday night. The call came in 17 minutes before the ambulances arrived. Multi-vehicle collision on Route 9. Interstate overpass. 8 confirmed victims. A school bus had clipped a concrete barrier at highway speed, overcorrected, and taken down 3 passenger vehicles in the resulting chain reaction. St. Carver's ER activated its mass casualty protocol. On paper, this was a well-rehearsed system. In reality, it was controlled panic administered by people running on 4 hours of sleep. Dr. Wells took command immediately. This was his environment. He had trained for exactly this. He moved through the ER like a man conducting an orchestra, loud, decisive, certain. He assigned teams, cleared base, called for blood reserves, activated the on-call surgical team. Everything looked, from the outside, like competence. But Maya was watching. And Maya saw what looked like competence and identified something different. A system that was organized but not triaged. A commander making fast decisions without complete information. A team responding to the noise, the most dramatic patients, the loudest injuries, rather than the most lethal. She said nothing. She watched. The first ambulance came through at 11:47. Then 2 more, almost simultaneously. Then another. The double doors crashed open again and again, each entry bringing another tide of blood and noise and urgency. That was the moment Wells told security to remove Maya from his ER. Because she was standing still. Because she looked, to every panicked eye in that room, like someone who didn't belong. What Wells didn't know, what no one in that room knew yet, was that standing still in chaos is not the behavior of someone who is lost. It is the behavior of someone who is commanding. Maya had spent 11 seconds performing a visual triage of all 8 incoming patients from the moment the first gurney cleared the doors. She had identified, in those 11 seconds, the following. 2 patients presenting with dramatic blood loss who were hemodynamically stable. 1 patient with no visible injuries who was GCS 12 and deteriorating. 1 child with a closed head injury. And 1 teenager, gurney 3, with a deviated trachea that nobody had caught yet. She delivered her diagnosis of the tension pneumothorax before Wells could finish his sentence about having her removed. He looked at the boy. He looked at the monitor. He looked at the trachea. Time slowed down. Wells had 12 years in emergency medicine. He knew, in his body, the way experts know things, what a deviated trachea meant. He knew what happened if you waited. He had seen it once, early in his career, and the patient had died on the table before they could decompress. 14-gauge needle, he said. Now, second intercostal space, midclavicular. The resident scrambled. The boy lived. But Wells was already moving on. And Maya was already looking at the next problem. 22 minutes into the mass casualty event, the system began to break. It broke the way complex systems break. Not all at once, but in cascading failures that each look manageable until they're not. The surgical team was delayed. The on-call surgeon had been in a separate procedure and couldn't scrub out fast enough. Two bays ran out of the correct blood type simultaneously. A monitor malfunction in Bay 2 went unnoticed for 4 minutes because everyone was in Bay 1. A nurse in Bay 5 made a medication calculation error that was caught, barely, by another nurse. And in the middle of all of it, the patient in Bay 7, the one with no visible injuries, the one no one was spending time on because he was conscious and talking, had a Glasgow coma score that was dropping. 8 minutes to irreversible brain injury. Maya had been tracking him since he came in. She had been watching his pupillary response from across the room. Right pupil, the left, back to the right. And the pattern had been telling her something for the last 6 minutes. She went to Dr. Holt, who was managing Bay 7. His right pupil is blown, she said. Epidural hematoma. We need a head CT and a neurosurgeon in the next 10 minutes, or we lose him. Holt looked at the patient. He had been focused on a laceration. He looked at the pupils. He went pale. Neuroconsult, he said to the nearest nurse. Stat. He looked at Maya. Something in his face cracked open, just slightly. I've got it, he told her. Go. But there was a larger problem. Bay 1. The two most dramatic-looking patients, a man with extensive road rash and a woman with a compound fracture, had absorbed the majority of Wells' attention and the majority of the senior team. They were loud. They were bleeding visibly. They commanded attention the way emergencies are supposed to command attention. The problem was that neither of them was the most critical patient in the room. That was the child. The little girl, 7 years old, small enough to have been thrown under the bus seat during the collision rather than against the window, had a closed head injury, bilateral lung contusions, and early signs of traumatic internal hemorrhage that were being read as stable because her compensatory physiology was holding. Kids compensate, and then they crash. And when they crash fast. Maya knew this. She had known it since the child arrived. She had flagged it to a nurse 10 minutes ago. The nurse had relayed it. The message had dissolved in the noise. Now the child's pressure was falling. Now Maya had 60 seconds. She looked at the room. Wells was occupied. The surgical team wasn't in yet. Holt was managing Bay 7. Every senior resource was consumed. She looked at Priya Okafor, who was standing at the edge of the chaos, managing her own patient, and was the only other person in the room who had been watching everything. Their eyes met. Priya was a second-year resident. Maya was a float nurse. Priya, Maya said. Bay 3. Now. And Priya, without asking why, without waiting for an attending, operating on 11 days of accumulated evidence that Maya Chen saw things other people didn't, moved. Maya was right behind her. What happened in Bay 3 in the next 4 minutes was the kind of medicine that doesn't appear in textbooks. It's the kind that lives in the hands of people who have worked in places where the nearest, or is a helicopter ride away, and the patient in front of you is all you have. Priya called out the assessment. Maya moved. She moved like someone who had run pediatric trauma cases before, not in a simulation, not in a controlled teaching environment, but in conditions where the lights were dim and the air was wrong and there was no backup coming. She found the point of hemorrhage. She communicated pressure and positioning and fluid management to Priya in a voice so calm it had its own gravitational field. She anticipated the interventions before Priya called for them. When the crash cart was needed, Maya was already at it. When the pediatric surgical fellow finally arrived, breathless, gloves half on, she looked at the child, looked at what Maya had done, and said, with the specific reverence of a senior clinician recognizing excellent work, "Who stabilized her?" Priya pointed at Maya. The surgical fellow looked at Maya. Maya was already at the next problem. It was Dr. Wells who asked the question that broke the dam. The crisis was resolving. Not over. These things are never cleanly over, but the acute phase was passing. The surgical teams were in. The critical patients were either stabilized or in the OR. The ER was shifting from chaos to the grinding management phase. Wells found Maya in the hallway outside Bay 3, writing notes that no one had asked her to write, on a piece of paper that wasn't a hospital form. "What is that?" he asked. "Timeline of the mass casualty event," she said. "Triage decisions, resource allocations, response delays. You'll want it for the debrief." He stared at her. "Who are you?" he asked. This time, she answered. "Maya Chun," she said. "Float nurse." Before that, a long pause. She looked at him with those level, measuring eyes. "I spent 6 years as a flight medic with the 68th Medical Company," she said. "Attached to a special forces group. 2 deployments to Afghanistan, 1 to the Horn of Africa. I ran trauma care in forward operating bases where we averaged 3 to 6 critical patients per shift, no surgical backup, and a resupply schedule that would make your supply chain manager cry. Wells didn't move. After I came back, she continued, I got my RN and spent 2 years at a level 1 trauma center in Baltimore. Mass casualty protocol, pediatric trauma, that was my specialty. A pause. Then I took some time off. Now I'm here. The hallway was quiet. You're a combat medic, Wells said. I was, she said. Now I'm a float nurse at St. Carver's. The ghost of something crossed her face. Same job, really. Just different chaos. Priya Okafor, who had positioned herself in the doorway approximately 45 seconds before this conversation started, was writing in her notebook with the focused intensity of someone trying to capture something important before it evaporates. She had already connected several of the pieces. The watch, the door-facing position, the hand moving to the hip, the instinctive threat assessment, the mass casualty triage speed, mass casualty logistics delivered as a passing comment. What she hadn't expected was the specific unit. She had served with a colleague whose brother was 68th Medical Company. She knew what that meant. She knew what those forward operating bases were. She closed her notebook. Dr. Wells, she said, stepping out of the doorway. He looked at her. She didn't just stabilize Bay 3, Priya said. She also caught the epidural hematoma in Bay 7 and the tension pneumo in Bay 1. And she tracked the pediatric patient for 22 minutes before anyone else flagged her. A pause. She was running a parallel triage system this entire event. Wells looked back at Maya. The climate in the hallway changed. 12 years of emergency medicine, 3 journal publications, 19 residents trained. He was looking at someone who had run trauma care in conditions he had never experienced and would never experience. Someone who had walked into his ER with a paper clipboard and identified, within minutes, the 4 patients who were going to become critical and had positioned herself to intervene when the system failed them. Why didn't you say anything, he asked. Earlier, before all of this. Maya was quiet for a moment. Because it's your ER, Dr. Wells, she said. I was hoping you wouldn't need me to. The weight of that sentence landed cleanly. He nodded once. A small nod. The kind that costs something. The appendicitis, he said. Gerald. Yes. Bay 7 earlier this week. The blood pressure trend. Yes. The journalist with the fake badge. She looked at him steadily. How long? He said. Have you been running a threat assessment on this department? Since Tuesday morning, she said. He exhaled slowly. 60 seconds to leave, he said. I know. He looked at her for a long time. Finish your notes, he said. He walked back into the ER. It was the closest thing to an apology she was going to get. It was enough. The debrief happened at 3 a.m. 9 people in a conference room. Coffee going cold. The fluorescent lights doing what fluorescent lights always do at 3 a.m., which is make everything feel true. Maya put her timeline notes on the table. What followed was 2 hours of analysis. The kind of granular, honest breakdown that good medical teams do when they want to learn rather than assign blame. Every decision point, every delay, every resource gap. Maya spoke when she was asked. Clearly, precisely, without performance. She identified 3 systemic failures that had nearly cost the pediatric patient her life. She proposed 2 protocol adjustments that would have cut response time in a multi-casualty event by an estimated 6 minutes. She noted, carefully, without accusation, that the triage system had prioritized visual severity over physiological risk. By the time she was finished, Dr. Wells had filled 4 pages of notes. Holt hadn't said a word in 40 minutes. Priya was on her 6th page. Sandra Platt, charge nurse, 22 years, unshakable, was looking at Maya with an expression that Sandra herself could not have named, something between admiration and a very specific kind of embarrassment. The intake desk, Sandra said quietly, near the end. Maya looked at her. I moved you to the intake desk on Thursday, Sandra said. And you watched Delgado's monitor from 40 feet away and got back there in time. You needed coverage at intake, Maya said. You were right. I moved you because I thought you were overstepping, Sandra said. Maya was quiet for a moment. I know, she said. Were you? Sometimes, Maya said. Probably. I'm still learning how things work here. A pause. I'm used to environments where there's no time for process. That's not always an asset in a hospital. Sandra nodded slowly. Stay on trauma, Sandra said. Not a question. Not a suggestion. A decision. Wells looked up from his notes. Agreed, he said. Maya looked at the both of them. At Priya, who was smiling at her notes. At Holt, who was looking at the table but nodded once, the kind of nod that means something between men and between anyone who has learned something the hard way. She looked at the window, where the first gray suggestion of dawn was pressing against the glass. She exhaled. "All right," she said. The little girl's name was Sophie. Maya learned this the next morning, when Sophie's mother found her in the hallway outside the pediatric recovery unit and held her hands and couldn't speak. She didn't need to. Maya stood there, in the same two big scrubs, still wearing the analog watch she checked like a compass, and let the woman hold her hands, and didn't say that she'd just been doing her job. She didn't deflect. She didn't minimize. She let the moment be what it was. She had learned that too, in the field, in the years between, that sometimes the most important thing you can do for someone is simply stay present when they need you to be there. Sophie's mother finally stepped back. "Thank you," she said. Maya nodded. She turned and walked back toward the ER. Behind the nurse's station, Tomas was already there, coffee waiting, 2 cups, like he'd known she was coming. She sat down. She picked up her clipboard. She went back to work. They told her she had 60 seconds to leave. She used those 60 seconds to save a life. And every second after that to prove something that needed no further proof. The question is, and I want you to think about this honestly, have you ever been dismissed by someone in the room, only to turn out to be exactly what that room needed? Drop it in the comments. Because I have a feeling more people than we think have had a moment just like Maya's, waiting for the right crisis to finally show the world who they really are.